Dun, 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 dun. Hello, how are you doing this beautiful Sunday afternoon? My name is Mariah Aunaya, and it is so great to have you here. Hope you're having a wonderful Sunday. Today, we're going to be talking about something a little bit more serious than we normally do. I'll see you shortly. Yay! It's good to have you here. As you probably know, my name is Mariah Aunaya. If you don't know, my name is Mariah Aunaya. What is your name? It is great to have you here. I am pleased to welcome you to our channel. We're currently doing a series on pregnancy, pre-birth, pre-delivery, and very soon we're going to move into motherhood. And we are researching, talking about, learning about everything pregnancy. So if you are new to that topic or if you are in that phase, then this is perfect for you. Okay? I'm trying my best. I am not an expert, although I am a mother of one. Yes, I am the latest mommy in town, even though my son is a little over 6 months old now. So, what are we discussing today? We already said it before, we're discussing gestational diabetes, okay? Oh, I don't think we said it. Anyways, we're discussing gestational diabetes and we're talking about it as laymen or laywomen. What do you think gestational diabetes is from the layman's point of view? I'm listening. I'm all ears. Yeah, if you guess that it is something sort of like diabetes where there's too much sugar in the blood or in the body, then you're absolutely correct. Let us go back to the foundation of everything. When we eat food, especially carbohydrates, it goes into our bodies and it is converted into a substance called glucose. Inside this same body, the pancreas produces a hormone called insulin that helps the body be able to absorb this glucose and turn it into fuel. Now, during pregnancy, at some point, the pregnant woman's body begins to resist this hormone insulin. But, it's still manageable or it still works somehow because the insulin is still produced. It's just that it is not as much, and thereby there's a bit of an excess glucose that is left out. Not everything is absorbed. That excess glucose that is left out is what the baby utilizes. Now the problem comes, or where gestational diabetes comes in, is when the body resists the production of the hormone insulin so much and there is a excess buildup of the glucose in the body or blood sugar, thereby causing a symptom that we know as hyperglycemia. There's just too much glucose, there's just too much blood sugar in the body. This symptom or this problem can further graduate into what we now know as gestational diabetes, where both mom and both child cannot handle the amount of glucose, that the body has. Now, I'm sure some of you think one of the causes of gestational diabetes is going to be eating too much sugary things, right? Well, that is not exactly the truth. In fact, that is not the truth. Carbohydrate, whatever you eat, is converted to this glucose. So at the end of the day, except you're not eating food, at the end of the day, it will happen. It will happen if you're prone to it. And there are some things that make some women prone to having gestational diabetes. Some of them are if you're older than the age of 25, if you come from a particular race, if you're black, Um, if your family, you have a history of diabetes in your family, if you're obese, like you're really big, you're obese, if you are, um, and the older you are, the more prone you are. That's why I said this topic takes its root in advanced maternal age. You're older, the more advanced in age you are, the more you're prone to have gestational diabetes. Ah, yeah, those are the basic causes, or those are the basic high risk factors that make you prone to it. But the actual cause of gestational diabetes is not known. So you may be all of these things and not even have gestational diabetes when you are pregnant. At the end of the day, is to monitor things and check things just in case. Okay, so how do you monitor things, or what do you do? At about the third trimester, a test is done on most pregnant women in a lot of hospitals. I say a lot, it's supposed to be all, but big clinic didn't do it. It was small clinic that did it. So in a lot of hospitals, a glucose tolerance test is done to check if you are prone or if you have gestational diabetes. Okay, and how is that test carried out? Typically, you are asked to come in fasting on a particular morning, and your fasting blood sugar is drawn before you're given a very concentrated dose of glucose. I think I was given like 50 cl, and a lot of glucose was put into it, and then it was very concentrated. Your hospital or your care provider will do the one that they know, and you're going to drink it. And then at about 30 minutes or 45 minutes or an hour interval, your blood is drawn again 4 times. I think 4 times your blood is drawn. If one of those readings is abnormally high, I think the first reading will spike definitely, because some like blood sugar is just coming to your system. So when they check your blood sugar, the first reading will be high to an extent. But if it is abnormally high, they're going to look at you with, this person is prone to having gestational diabetes. So let's look at the person. But if two of those your blood sugar readings are normally high, then the case is probably that you have gestational diabetes, and you're going to be you're going to be monitored very closely. The reason is because people who have gestational diabetes are prone to have hypertension. That is, the mothers are prone to have hypertension. Your babies may have like really, really high birth weights. The normal birth weight is 2.5 to 4 kg, but women who have gestational diabetes tend to have children who are above 4 kg, and that is very risky. Because of the high birth weight thing, you're prone to have a C-section, because it may not be easy to deliver vaginally. It's bad enough because gestational diabetes can actually lead to having a stillbirth. So even from when they discover, or when the person is noted to have it, they're going to tell you to start doing a fetal movement chart, which is supposed to come later on in your third trimester. They're going to start it at that point because they want to monitor things. They don't want things to go out of hand. And the person who has gestational diabetes, even if the person doesn't have just diabetes before, you're prone to having type 2 diabetes later on in life. So also is your child. Your child is also prone to having respirational problems. Your child is prone to having, I think, jaundice as well. So there are lots of risks to it. Once a person has gestational diabetes during pregnancy, you have it. There's nothing that you can do about it until you deliver. It is going to be managed till you deliver, and after you deliver, you're probably going to go back to being the same. It's just that you have a risk of having type 2 diabetes later on in life, or if you're pregnant again, you have a risk of having gestational diabetes again. Okay, how then is it managed if you have it? And even before time, how then do you try to prevent it? Well, eat healthy. Well, eat healthy. Eat healthy foods. Drink healthy things as much as you can. Even though it's not necessarily sugary substances that causes it, you don't want to be loading your body with too much sugar as a pregnant woman. As you've heard, at some point, your body begins to resist the production of the hormone insulin. You also want to exercise. It is said that exercising, it will help you to burn, it will help you to utilize, the fuel, the glucose, and to burn the fat. So just try to exercise as much as you can. For if you already have the symptom, if you already have it, there are ways to manage it. They may even give you drugs or medicine to help you manage it. They will put you on a diet too to help you manage it. I hope that this talk, a little discussion, has shed a little bit more light on gestational diabetes. Try to do justice to it. I hope I did. I didn't have it, even though I went through the glucose tolerant test. And to anybody that has it, don't feel bad. You will come through it. Just work with your care provider and you will come through. Okay? I love you guys, and I will see you next week where we'll be talking about pre-eclampsia. Bye.